Dear friends, hello, this is Dr. Jambukeswaran, our PrepLadder Orthopedic faculty for you. So today we are going to see the recall session of the yesterday's FMGE July 24 exam. I hope I'm audible. Just give a thumbs up in chat box so that we can proceed. Anybody? Yeah, Jaimin Manats. Namaskaram. Yeah. Yes. Excellent. Okay. So we'll proceed, dear friends. And I had spotted some 9 questions in orthopedics in yesterday's exam, FMGE. And in my thing, Amit Kumar, thank you. Thank you for your thumbs up. Amit Kumar, thank you. So see, 9 questions I spotted, and in my thing, all the questions are okay questions. I think our guys would have done really well. Okay, so I feel happy for you. As far as ortho is concerned, it's a okay paper. It's a good paper. Not much of problem. Okay, yeah, we'll see. We will start with our session. The first question goes like this: a 50-year-old female complains of bone pain for several months. This is very important. For several months, it's not of acute thing. Its chronicity is there, and the X-ray of the skull shown below. The X-ray of the skull is shown below. You're seeing the X-ray. This is the X-ray that's given, right? When you observe the X-ray of the skull, I am able to see. Okay, yes, and Sani Yadav, you are given the right answer. Superman, super. You see. I'm able to see, are you able to see some fluffy mosses here, calcified fluffy mosses? I will rub that, you just zoom and see. They are called the classical cotton wool spots. Cotton wool spots. Okay, so cotton wool spots, very classical. It was already written, sir, cotton wool. Okay, so it was in the question itself, but easily seen, the X-ray shows cotton wool spots. Cotton wool spots, whenever you see in skull X-ray, classically that is seen in Paget's disease. Okay, so in our recall, in our previous FMG YouTube sessions, we had discussed this already, cotton wool spots. Let us see very quickly, just 10 seconds. Paget's disease is otherwise called osteitis deformans. Primarily, that's a disorder of osteoclast, overactivity of the osteoclast. So osteoclastic activity, excessive osteoclastic activity followed by excessive osteoblastic activity, bone turnover is more, and faulty formation of micro arteriovenous fistulae form in the bone. That's why the cut section Robbins gives, it gives a honeycomb appearance of the bone. In skull, I want you to remember, one, I'm able to see here, no, fluffy images, cotton wool spots. Another important thing, X-ray finding of the skull is osteoporosis circumscripta. Osteoporosis circumscripta. Another X-ray skull finding in Paget's disease. So Paget's disease, skull finding, cotton wool spots, osteoporosis circumscripta. When you see this, there is overhanging of the frontal portion of the skull, overhanging frontal bone of the skull. It gives an appearance which is called tam-o-shanter. Tam-o-shanter, a character name, tam-o-shanter. Okay, hat appearance. Tam-o-shanter hat. Okay, it's called a tam-o-shanter hat appearance. So, the skull finding of Paget's disease. Apart from that, in vertebra, you will get a picture window frame vertebra, blade of grass appearance of the bone, honeycomb appearance of the bone. These are general. In skull alone, 3 findings one should not forget. Cotton wool spot, tam-o-shanter hat appearance, then osteoporosis circumscripta. We'll move on to the next question, dear friends. I hope most of you would have answered this well, right? Excellent. You see, Codman's triangle, very straightforward question. It is there in our YouTube session. Codman's triangle is seen in which of the following condition? Classically, Codman's triangle is a word reserved for. What's the answer? Hello? Yes. Yes. So, Mukul, Diman, Akash, Kotkar. You had given the right answer. Osteogenic sarcoma, Codman's triangle comes under, yes, Amit Kumar. Yeah, excellent. So choice C, it is osteogenic sarcoma. See, dear friends, Codman's triangle is one form of periosteal reaction. Periosteal reaction in bone. What are the conditions? Okay, so Dua Mariam, choice C, excellent. See, yes, I will discuss. See, periosteal reaction, is that seen only in osteogenic sarcoma? No. Common cause for periosteal reaction, I'm not going to write, I will tell. Common cause for periosteal reaction, osteomyelitis. Second important cause for periosteal reaction, scurvy. Third important cause for periosteal reaction, congenital syphilis, periosteitis. Fourth cause for periosteal reaction, myositis ossificans. Fifth cause for periosteal reaction, bone tumors. That's osteogenic sarcoma. Okay, so in bone tumors, periosteal reaction comes in different form. One form is your elevation of this periosteum. Elevation of this periosteum, and this is called Codman's triangle. Codman's triangle. Next form of periosteal reaction in bone tumor, when you see here, lot of, okay, bursts, as if the main mass is here. And see, osteogenic sarcoma is a highly vascular tumor. It's a highly vascular tumor. The main mass, a lot of blood vessels leaches out, and microcalcification happening along the border of the blood vessel, which gives the classical sunburst appearance. This is the second form, sunburst appearance. If it is Ewing's sarcoma, multiple striped layers of periosteum, which gives onion peel appearance. So all these are periosteal reactions, the various form. So two types of reaction, periosteal reaction is possible in osteogenic sarcoma. Number one, Codman's triangle. Number two, it is sunburst appearance. We will move on to the next question. A 17-year-old patient presents with growth behind the heel on talus, as shown in the image below. What is the thing? Okay, so dear guys, anybody? See, I am able to see, this is the whole bone, this is the talus. This is the talus. From talus, I am seeing an exophytic growth on the posterior aspect. Anybody? Yes? Yes. Mukul Diman, Sani Yadav, and Srinivasan Jayasheelan. All of you had given the right answer. Marvelous, man. It is osteochondroma, otherwise called exhastosis. Okay, so exhastosis alone can give an exophytic growth, a cauliflower-like growth like this. It cannot be enchondroma, because enchondroma happens as a ring in the cancellous bone, especially in the phalanges. So exhastosis can happen in many places. But I am telling you, this site is a rare site. The most common site of exhastosis everyone knows around knee joint. Okay, this is a rare site, but this is classically, this X-ray is an X-ray of exhastosis, otherwise called osteochondroma. We will move on to the next question. Using the X-ray below, identify the type of Salter and Harris classification. They had given an X-ray. What type of Salter-Harris classification? They had asked this question. So answer please, dear guys. Hello? Anybody? Hello? So this is straightforward. Anybody? Shall I tell the answer? In the chat box, I am not getting any answer. Yes, Mukul had answered as type C. Dua Mariam, type C. Yeah, I have to analyze. Okay, this is the image, and yes, Be the Best has answered type B. Yeah, Be the Best. Yes, 1 minute. Many of you are answering, and few are answering type B as the choice. Some are answering C. I will give you. This is the image which I got. I really don't know what is the image that is given in the exam. Okay, I got this. I will discuss. I will type 2. Yes, Mukul Daiman has changed to type 2. Then that should be the image. Yes, you see, I am able to see this is epiphysis. This is metaphysis. This epiphysis is carrying a small triangular bit of metaphysis. See this triangular bit. This is called Thurston Holland sign. This is called Thurston Holland sign. Okay, now you see this, you can see that very classically that triangular bit of metaphysis with your epiphysis. Triangular bit of metaphysis with the epiphysis. Thurston Holland sign classically belongs to type 2. And we all know this is the most common type of epiphyseal injury. And it is there in our YouTube session, it's there in our PrepLadder app. Detailed, I had discussed. Just you go through this. Type 1 is complete. Salter-Harris is no more Salter-Harris, dear friends. It's called Salter-Harris and rank classification because Salter-Harris has given only up to type 5. Rank has added type 6. Okay, type 6. So, type 1 is complete separation of epiphysis from metaphysis without fracture. Alright. Type 2 is complete separation of epiphysis carrying a small triangular bit of metaphysis. You look at this. This is in our app. This is the diagram, schematic diagram. You see exactly this X-ray is like that. And so it is type 2 Salter and Harris epiphyseal injury. We'll move on to the next question, dear friends. A patient had fallen on outstretched hand. The X-ray shows the first metacarpal joint fracture along with subluxation. We all know, dear friends, it's very clear. You see here, these are the choices I have received. Okay, these are the choices. Yes, Akash Kotkar, you have answered already correctly. Marvelous, man. You see, I am able to see an oblique fracture here in base of the first metacarpal with subluxation. This is called Bennett fracture. The closest, definitely this scaphoid is here. It's normal. Colles fracture has to happen here somewhere. Extraarticular fracture of the distal radius. Reverse Colles is Smith fracture. Nothing to do with this. So this is clear cut. A case of yes, right. Okay, many of you have answered. Basit. Okay, many of you have answered it correctly. Marvelous. Okay, so your Akash have answered. Best Irshad has answered. Marvelous. Okay, Srinivasan Jayaseelan have answered. Trevor, Dr. Roland was there. Okay, so Trevor. Okay, so Amit Kumar said there was a question, Roland. Yes, I am coming to. So instead of one choice, Roland fracture was there. Roland fracture was there. It's called Roland, not Roland. It is called Rolando. Rolando. Okay, it should be Rolando. Okay, Rolando fracture was there. That's what some of you have discussed. I will tell you, if it is Rolando, here this fracture should not be a single piece like this. It should be comminuted. Many pieces comminuted. That's why I'm having a slide. The closest possible differential diagnosis for Bennett is Rolando. Both Bennett fracture and Rolando fracture are fractures of the base of the first metacarpal. Both are intraarticular. Some wrong teaching is happening, semi-intraarticular. There is no such word in ortho called semi-intraarticular or something intraarticular, extraarticular. That's all. Both the fractures are intraarticular, man. Both the fractures are intraarticular. If it is an oblique fracture, it's called Bennett. If it's a comminuted, it's called Rolando. You see, I'm having a diagram here. You see, this is how the X-ray looked, and this is a Bennett fracture. If it is thrown into multiple pieces, just I had enlarged this into multiple pieces like this, that is called Rolando. Both are, so that should be a Bennett fracture. That should be a Bennett fracture. You see, dear friends, the problem with Bennett fracture, even though this is a very simple fracture, this should be fixed with a K-wire because one fragment is attached to abductor pollicis longus tendon. So when fracture happens, abductor pollicis will always pull. There is a chance that this can go for non-union, and it's inside a joint also. We need a full function. So this fracture should be fixed. With this, we'll move on to, yes, there was, Amit Kumar is telling, and there was no X-ray. Okay, there was no X-ray, right? Okay, right. You see, we'll move on to the next question. Patient had a road traffic accident and sustained fracture of both tibia and fibula following a primary impact injury. Primary impact means the vehicle has come directly hit on that part. primary impact injury. And what is the name of the fracture? See, when you stand, the bumper, the front portion, the bumper is otherwise called fender, comes and hits exactly at the level of your, almost at the level of your knee joint. And the common fracture that will develop is called lateral tibial plateau fracture. And that lateral tibial plateau fracture is called bumper fracture, otherwise called a fender fracture. One more name is there, fender fracture. Okay, and to be very, very honest, the classical teaching, a bumper fracture should be an isolated fracture of the lateral tibial plateau. Very rarely, since it's very close to the head of the fibula, that may also get fracture. That's what they had asked. And the answer is bumper fracture. This should be the right answer. Right, and you see this x-ray, yeah, so this is a classical lateral, this is fibula is here, some fracture has happened, lateral, the tibial plateau is totally shattered like this. Okay, so this is a classical bumper fracture. This should be fixed, dear friends. The treatment of choice for this kind of x-ray is open reduction internal fixation with lateral tibial plate. Okay, that is called cobra plate, that we'll see later. Okay, so this is called a bumper fracture. With this, we'll move on to the next. Identify the stage of tuberculous hip in a female with left leg shortening. This they had asked. According to me, this is a highly controversial question, dear friends. I will explain why. Obviously, the answer is, see, what is, I will write what are the stages names. The stages is called Babulkar and Pandey stages. Stages of tuberculous hip is called Babulkar and Pandey. It is there in our main recording. It is there in rapid revision. And in YouTube session in tuberculous hip, I had discussed this already. You see, stage 1 is called stage of synovitis. Synovitis. This is called stage of early arthritis. Early arthritis. This is called stage of late arthritis. Stage late arthritis. This is called stage of pathological dislocation. Pathological dislocation. Okay. Pathological dislocation. The problem is, dear friends, in stage of synovitis, flexion, abduction, external rotation, there is limb lengthening. So definitely this can't be the answer. In stage 2, stage of early arthritis, in stage 2, stage of early arthritis, what happens? Flexion, adduction, internal rotation, there is apparent shortening, not true shortening. So this definitely can't be the answer. In stage late arthritis, the joint is totally damaged. Patient have flexion, abduction, internal rotation with true shortening. So this is right answer. Stage 4 is stage of pathological dislocation. In pathological dislocation, what happens? The acetabular rim has totally damaged, and it is, the head of the femur is out of the socket like a posterior dislocation hip. Flexion, abduction, internal rotation with again marked shortening like posterior dislocation hip. So this is also, so this is why I am telling this is controversy. 1 and 2 definitely can't be the answer. 3 is a possibility, 4 is also a possibility. 3 is a cause and 4 is also a cause for shortening. So this is what Ashish Lohit, option A was cannot be determined by picture. Okay, and I heard they had given a diagram for this. Dear friends, if I get the proper diagram, to some extent we can rule out whether this or this. Okay, so this is called Babulkar and Pandey classification. Stage 1, definitely there is apparent lengthening, stage of synovitis. Stage 2, apparent shortening, not true shortening. Stage 3, true shortening is there. Pathological dislocation, marked shortening is there. Okay, so this, among the 9 questions, I personally, the image was like girl folding her leg. Sai Praveen has given me a clue that folding her, that means flexing the leg. Akash Kotkar, there was no such question. There was no such question. Gorgeous girl, picture of a woman given with shortened legs. Okay, so gorgeous girl is given. Yes, sir. Image was of a girl. Akash Kotkar. Yes, okay. So that should be. So mostly, I think C should be the answer. Mostly C should be the answer. Flexion, adduction, internal rotation. Okay, C should be the answer. In case of late arthritis, true shortening. Okay, but In 9 questions, the only controversial question is this, dear friends. All other questions are very straight. Okay. Yes. Let us see. Yes. We'll move on to the next question. This is a very direct question, nothing to think. Yeah, it is. I don't know whether it was in biochemistry session or in ortho session, but the answer, vitamin D deficiency, which vitamin deficiency is seen in rickets? Obviously, it should be vitamin D. In our country, the most common cause is nutritional. In Western world, throughout the world, it is renal rickets, otherwise called resistant rickets, which is an X-linked dominant condition. Very detailed rickets, our discussion is there in our YouTube session. It is there in our recording. Kindly go through. Yes, yes, this was a question. Okay, look and call. Yes. So vitamin D is the answer. Coming to the last question. This is the 9th question. Right, Anil Kumar. The photo was the knee was in bit flexed. The leg was adducted and externally rotated with cloth over the body. Okay, externally rotated means it cannot be a shortening, man. If externally rotated, the length should be more. Lengthening should be there. But the question they are telling shortening. That's why I'm telling it's highly controversial. Supine patient, left leg on the leg was extended and the right leg was slightly flexed and the knee shorter. Okay, knee shorter. Okay, right. No problem. Yes, coming to the last question. A motorcyclist met with a road traffic accident, had a metacarpal fracture. Had a third and fourth metacarpal fracture. Hypothenar atrophy. That's all. Hypothenar muscle wasting. The answer should be ulnar nerve. And we all know, dear friends, there is a thing called Guyon's canal. There's a thing called Guyon's canal. Common area of compression of ulnar nerve. Guyon's canal is otherwise called ulnar canal. The medial side is bounded by your pisiform and the lateral side is bounded by a hook of hamate, and it is by over its palmar carpal ligament on the roof and your, okay, so flexor retinoculum on the floor. So compression of this can cause atrophy and wasting of the hypothenar muscles. Here the fracture has happened, so high chance it can cause compression of the hypothenar muscles. So ulnar nerve should be the answer. So ulnar nerve is the answer. Okay, so with this, in short, we have completed the 9 questions. Out of 9, 8, no controversy. 1 question is little controversial. Let us see. And I hope, dear guys, you guys, I pray to God, surely none of you will fail. Okay, so all of you will clear this FMGE happily. Okay, keep in touch with us. All the rest, dear guys. Thank you so much.